Can complaints related to benign prostatic hyperplasia be treated effectively and still gently? We will show you which medications are suitable for this in this video. My name is Dr. Pedram Derakhshani, and I am a specialist in urology at the clinic at the Ring. Benign prostatic hyperplasia is a condition that affects older men. About 85% of men over 60 years old are affected by it. The enlarged glandular tissue of the prostate constricts the urethra. As a result, the strength of the urine stream decreases, leading to dribbling and nocturnal urination. The first step for such complaints should always be a visit to the urologist. With a few simple and non-invasive examinations, the urologist can rule out prostate cancer on one hand and determine the stage of the prostate enlargement on the other. In the early stages, without residual urine formation or kidney obstruction, often no treatment is initially necessary, and only regular, usually annual checkups by the urologist are conducted. If the prostate enlargement increases over the years and is not effectively treated, it can lead to complications. The bladder is only partially emptied, painful urinary tract infections can be the result. In the worst case, it can lead to a complete blockage of the urethra, known as urinary retention. Which medications are suitable for the treatment of prostate enlargement? In the early stages and with mild symptoms, therapy with herbal active ingredients has a long tradition. Preparations with saw palmetto, pumpkin seeds, nettle root, or combinations thereof have proven effective. These can especially alleviate subjective complaints well in the early stages and have few side effects. If herbal remedies do not achieve sufficient effect, or if residual urine formation is already present, chemical medications, especially the so-called alpha blockers, such as tamsulosin, are used. They facilitate bladder emptying by relaxing the muscles in the prostate and bladder neck. A significant improvement in complaints and symptoms often occurs within a few days. Possible side effects primarily include dizziness, fatigue, and low blood pressure. In some cases, it can lead to a dry orgasm, known as retrograde ejaculation. A third group of active substances, the 5-alpha reductase inhibitors, slows down the conversion of testosterone in the body and thereby inhibits the cell growth of the prostate. The volume of the prostate reduces, and the pressure on the bladder and urethra decreases as a result. However, their effect sets in very slowly. It can take several months for the symptoms to improve. Men with significantly enlarged prostates particularly benefit from therapy with 5-alpha reductase inhibitors. In Germany, Finasteride and dutasteride are available. The side effects are generally minor, although some patients report a decrease in libido and potency or breast growth. In the so-called combination therapy, alpha blockers and 5-alpha reductase inhibitors are used together to alleviate symptoms as quickly as possible while simultaneously inhibiting further growth of the prostate. Combination therapy is an option for men with very severe symptoms and a significantly enlarged prostate. If, despite taking the medications, there is an increase in symptoms or prostate volume over time, the next step is a surgical procedure. Nowadays, this can be performed very effectively, yet safely and gently, using various laser techniques. We will show you more detailed information in another video. If you would like to learn more about the treatment of benign prostatic hyperplasia, simply schedule an appointment with us here at the West German Prostate Center in the clinic at the Ring in Cologne. We look forward to seeing you.